I'm going to kick off formally this event now. I'm Bronwyn Fredericks, a Guru Murray woman from Southeast Queensland, and will be facilitating this afternoon. I am introducing as the chair of Croakey. I do acknowledge country and where all of us are in terms of the elders past and present and the land bases where you all zooming in from this afternoon. I do want to also note them for their advice, leadership, custodianship at sometimes difficult times, particularly in recent time. I will note that this month is 10 years since Croakey launched. Yes, 10 years of Croakey, and that Croakey's been out there as an independent news publisher. So yay, Croakey. Let's have a cheer. Come on. Yay, take off mute or clap or whatever. Yay, Croakey.
Yay,
yeah, that's
Croakey.
right. 10 years is a big feat for a, community independent news publisher. So, we do have to acknowledge that. Before we begin, it's also important to reflect on the events. I think in past weeks, there's been lots of things happen, but I think what's happened for me in terms of focus is seeing that the harmful racist comments and the increasing number of those across a range of issues, but in particular, we saw that come to a head in regards to camp sovereignty in Naarm over the past weekend. And we're seeing that also around Australia and in other forums, as I've said, whether it's social events, whether it's actions. I was at a concert just on Friday evening, and when they went to do the acknowledgement to country from the stage, this is at an Ice House concert. The guy next to me just went right off. And it was actually other members of the crowd that curtailed him and spoke to him that it was totally inappropriate and not called for, and he was at the wrong kind of concert if he was doing that. So, go the public as well in terms of stepping up. So we have seen also people come together to say no to racism and no to hate, and large gatherings of people coming together. We've seen that down at Camp Sovereignty. And I also see that there's a number of rallies and comings together planned, whether it's in the big urban cities or in regional areas over the next little while, this weekend and further weekends ahead. And that really speaks to the power that communities can assert, and we as individuals can assert together with others collectively when we stand together. And I'll just say when we stand up together, walk together, and also work together to try and combat, that negativity or issues that we don't agree with, rather than stay silent. I am delighted to be here this afternoon, that we can do this together and have this discussion, number one, at the 10-year mark for Croakey, but it is the first open planning session for the new initiative from Croakey that will focus on primary healthcare community matters. So I think it brings a range of a few issues together and can motivate all of us and others to, bring forward further action. If you're going to be tweeting or putting posts up on Facebook or LinkedIn or any of your Instagrams or whatever tonight, and going forward, the hashtag is PHC Matters, all like one. So hash PHC Matters. Just say that one more time. Hash PHC Matters. When posting any of the discussions or comments about tonight. And we hope that people do follow that and pick up on that. And it is a step up in journalism around primary healthcare in Australia, but also further afield, and that people start to tell stories from their local communities of what they're doing and how they're doing it, and use that hashtag. So let's start a movement with all of that. There is a lot of important work happening broadly around health and well-being, and whether, for some things it's little and other things it's big, but it all does take energy. And I'm very thankful for those individuals connected to Croakey and other organisations that do that. And as I can assure you that others are thankful too. I do want to, from Croakey's point of view, to thank those individuals and organisations who have given their time and ideas to help with the development of this important and innovative initiative, the project to amplify expertise around the concerns of local communities under the banner of Primary Healthcare Matters. In particular, I would like to acknowledge the Northwestern Melbourne Primary Health Network. Are you here tonight with us as well? Are people here from the Northwestern Melbourne Primary Health Network?
Yes, I'm here.
Excellent. That's great. Great to see you be part of this tonight. And also the Australian Physiotherapy Association. Someone here from them?
Yes, thanks, Bronwyn. That's me and my colleague Rachel as well.
Excellent. Great to have you here with us today. Thank you.
Thank you.
Those both organisations and for sending people along for late this afternoon, early evening for this. And we hope that you've followed this up, not just with helping and adding in, but also with being foundation funders of the initiative. So thank you for your generosity as well. And we hope that other organisations and leaders will follow in your example. So thank you. Thank you to Chris Carter, Chief Executive of Northwestern, for the statement as well, noting that the past decade of Croakey has been a trusted source for policymakers, health professionals, advocates and community members who dedicate their lives to our healthcare system. Informed, engaged communities are crucial partners in this system, and the team at Croakey work tirelessly to inform and engage them. I'd also like to thank Rick Dawson, National President of the Australian Physiotherapy Association, for your comments that Croakey plays a vital role in connecting health professionals, policymakers, and communities in meaningful dialogue. I also note your comments that our new PHC Matters hashtag project follows an important platform to strengthen primary healthcare at a time when innovative, collaborative solutions are urgently needed. And I reiterate that they're so urgently needed. We need to step up all the work that we do. I also wish to acknowledge at this point to the Independent News Association for a grant that will support some related journalism on primary healthcare and environmental health matters going forward. So thank you to you too. Since December 2008, 1st of December 2008, Croakey has published, ready, 1,029 articles on primary healthcare alone. And since December 2020, Croakey has published 200 articles about the ACCHO sector, the Aboriginal Community Controlled Health Organisation sector. That's some amount of publishing, hey? Hey? That's some articles. We've recently published 2 articles by Alison Barrett, giving an overview of the issues raised by articles on primary healthcare in our archives. So the fact that Alison's done that, and I know other people use the archives of Croakey to go and use, for quotes, to reference in other papers. I've seen that also, people using Croakey in referee papers. I've done that myself as well. But the links for those articles by Alison are going to be put in the chat. We do look forward to hearing more from you all today with ideas for stories and also initiatives for the new hashtag for the PHC PHC Matters portal. That's a bit hard for me, all that word. PHC Matters portal, which will launch early next month. I'm now going to hand you over to our chief editor-in-chief, Dr. Melissa Sweet, for a short overview of the initiative, and then we all want to hear from you. So we want to hear from you then. Over to you, Melissa.
Thanks so much, Bronwyn. We know you're an extremely busy person, so we're very grateful to have you here today. I'd like to acknowledge that I'm joining from beautiful Malakadi country in southern Lutruwita and pay my respects to all who've cared for these lands and waterways over millennia. And I also acknowledge First Nations people joining this discussion today and the presence and contributions of Croakey Health Media directors and members. So many people contribute so much of their time and energy to Croakey, and I feel extremely privileged to work alongside alongside such a bunch of committed people. And it's lovely to see some familiar faces in the Zoom today. I won't speak for too long because today is really an opportunity for us to hear from you. When we say primary healthcare, community matters, what are the issues and the stories that come to your minds? As you know, at Croakey, we are very focused on health equity and providing a platform for undercovered topics and underserved communities. These are the lenses that we will also bring to the stories for PHC Matters. We want to take a strength-based, solutions-focused, holistic approach to our examination of the issues affecting the health and well-being of local communities. And just to let you know, Croakey editor Jason Staines. Jason, do you want to just say hello, send a wave? We'll be writing up a story from our discussions today. So just keep that in mind. If there's any reason that you want to make a contribution, but you don't want to be quoted saying it, just make a note in the chat or when you're speaking, and we'll respect that, of course. Jason also has some questions that he wants to drop into the chat, so if you can keep an eye and engage with those. And Bronwyn will also be moderating questions and comments from around the Zoom. And just to let you know, I think you can see in the chat that another Croakey journalist, Mari McInerney, is also online, and Mari is also researching stories for publication when the PHC Matters portal launches in early October. So Mari may reach out with questions as well. And thanks again to Nell and Lena, because Lena gave us a grant that's enabling Mari to do that research. So thank you for joining us today, for your engagement with public interest journalism. It is a really tough operating environment for independent media, and so we're extremely grateful when people step up and support us. Now more than ever, we need newsmaking that is committed to equity, to evidence, and to caring for our communities in holistic, effective ways. Should any technical problems arise, just rejoin us at the Zoom link. Hopefully that won't happen, but you can never know. So, Bronwyn, shall I hand back to you, and perhaps we can hear from a few people?
I just want to, I'm here to just say, we'll open the platform for everybody to talk, and people to when you do talk, please introduce yourself, and then think about what you're going to say. And I'm going to tell you the questions that we'd like you to touch on in terms of some of your responses. You may have other things as well that we haven't put in the questions. But what stories would you like to see told from local communities and primary healthcare? What are untold stories? And what are some examples of successful primary healthcare models from around the country? Maybe it's that should be conveyed in stories. What are some examples of successful initiatives? Or, could be a particular innovative project for health and well-being being driven by local communities that communities are taking the lead on and doing. And what are the biggest barriers to wider implementation or transferability or wider uptake in terms of comprehensive primary health care? All right. So remember, the first thing, introduce yourself, and then have some of those things in mind when you talk. So let's open the platform, Mitchell. Yep. Who's going to kick us off? Thanks for putting that in the chat. Come on, I'll pick on people if you don't put your hand up.
To kick you off.
Who's that? Oh, wonderful, Anne. Thank you, Anne.
Yeah, hi. And I'm doing that primarily. I'd rather not kick you off, but I know I've got to go into an appointment in about 10 minutes. So I'd just like to make my contribution. So thank you for this opportunity. I'm the CEO of Emerge Australia. We look after people with myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID, and other energy limiting conditions. We have done some work with Croakey, and I recognise the wonderful collaboration that we've had with Northwestern Primary Health Network a couple of years ago in collaborating on putting a health pathway together for ME/CFS, which has paved the way for other health pathways around the country to be developed. I don't know whether I've got the wrong end of the stick, but from the perspective of people with MECFS in community, and there's about 250,000 people with MECFS and probably another 400,000 with long COVID. The biggest issues around this disease area rest with education of our primary health providers. So the education of GPs to be able to diagnose, manage and treat MECFS. And the sooner a patient is diagnosed, the less time hopefully they take in having a better quality of life. And some people don't recover at all. So I don't know whether I've got the wrong end of the stick, but I think the patient stories, and we have a lot of them that we work through people who write to us because we're the national patient organisation for people with MECFS. The patient stories about GPs, the good ones and the ones that don't know anything about MECFS and don't want to know anything about MECFS are many. And our community cries out for clinical education and the engagement of GPs to be able to better manage that patient cohort around Australia. And I'll just add that Emerge Australia is the only organisation in Australia right now conducting our ACCHO accredited clinical education to GPs. So I don't know if there's a place in your discussion for those issues, but they're major issues, and I haven't even touched on data or the incidence and prevalence of MECFS in the Aboriginal community. I haven't even gone there because, you know, we haven't really been, government really hasn't been collecting data on the incidence of this disease. So there's a long way to go, and particularly our core communities and our Indigenous communities are very disadvantaged, even more so. So I don't know where that leaves you all, but that's just my comments.
Thank you for that, Anne. Margaret, you got a question or comment?
Oh, comment, thanks, Bronwyn. So I'm Margaret Deering. I'm the Director of Policy at the National Rural Health Alliance. Just one idea that struck me is that, you know, the government's funded all of those innovative models of care, IMOC grants, PRIM grants, which are all about putting some money into primary care and rural particularly to do some innovative things. But what happens, of course, is that they get the grant, they do some innovative things, and then the grant runs out and, you know, they've got nowhere to go. And none of that learning is shared, basically. So there's been some great projects. There's IMOC 1, 2, 3, 4 and 5. 5 was the last round, in which we're actually a partner with a primary care organisation up in North Queensland in Mareeba. So all of these projects are coming through, great learnings, but, you know, there's no forum for some of that information to be shared about what they're doing, to share resources, to get new services into places. So that's just one idea. I can put the link to the IMOC grants.
Thank you. Thank you, Margaret, for sharing that. And thank you again, Anne, for sharing the work that you do and the difficulty you're experiencing too, and also people with energy limiting conditions have their needs. And I've put that onto my list here. I'm sure Melissa's got her list going as well, and Alison. All right. We move to somebody else. Laura, you got Laura? I'm going to start picking now. I'm going to start asking people. Laura Allen?
Oh, yep, I'm happy to go, but Anne just spoken. She's my CEO, so I feel like she said a lot. I was like, oh, I shouldn't probably.
Anything you want to add just to to bring back that to Anne, or you
Yeah, I think
wanted to add something?
I think one of the things I'm work for Emerge Australia. I'm the health and support manager with a background in nursing and doing my public health as well. And I think the thing that really strikes me about the community is the lack of acknowledgement of the severity of the illness. So, for example, the most unwell person I've connected for is end stages palliative care level of health, but they won't die. They will be like that for years and years and years. And one of the boys' mothers that I've connected to, he's been there for about 5 years now. So I think sometimes in the energy limiting, we think of common energy limiting diseases like heart failure, asthma, and lung disease. But for this illness, that level is really unrecognised. And when these patients head to hospital for help, it's often seen as a psychosomatic illness rather than a physical biomedical illness.
Yeah, that makes sense. It must be so frustrating for those individuals and traumatic, repeated trauma of not being believed. Yeah,
I think the trauma, especially, for those that are that severe, it's pretty devastating, and for the families. Sometimes access to NDIS is not possible because they're not well enough to get to the doctor and they're not believed, so they don't have a specialist to fill in the paperwork to get the help. So it can be quite the journey.
Thank you, Laura, for giving us that. Okay, let's hear from someone else now on another matter, maybe. Oh, Tan Nguyen, you're online. I just saw you put up something around health economics or oral health advocacy. Yep. All right, we'll have a look at that. Melissa, you got that? You can see that in the chat.
I think Judith has
go. I could have a go if that's okay.
Yeah. Does Tan Nguyen want to have us talk about this at all?
I think he's on a bus.
Oh, he's
so
on a bus.
He may not be able to talk.
Oh, you're on a bus. All right.
But Judith is there.
Judith, we'll hear from you.
Hi, I'm Judith Lovell. I'm the Academic Program Manager at Bachelor Institute here in Mbuntua.
Yep.
We have some really good, innovative, community-based work emerging around food, access to food, reliable and ongoing access to food, looking at research translation and translational research needs. So I know there's a lot of work. We're looking at the new federal guidelines and the national the national outlines, which are linked to closing the gap and NIA high-level measures. These are kind of familiar and incredibly important, but there still is a very large gap between those policy ideals and what we experience in our region. And we're particularly interested in the relationship of disordered eating and mental health outcomes. And there's kind of quite a gap in that space. I've been on the Croakey archives looking at food security and food insecurity reporting, and there's a great collection there. In terms of positive innovations, I don't know that you could call it an innovation, but some of the positive stories that came from one particular region through Croakey Health back in the 80s and 90s, and the contrast between the result of traditional food source and access to hunting and country on people's health and wellbeing, putting them 40% above the health of other Aboriginal and Torres Strait Islander people in remote Australia in those days, and that, you know, has slid away. So there are two main challenges I'm seeing at the moment that I think the group are really wanting to work on, and one of those is how to take that community-driven knowledge and insight towards systems effects, but in a timely enough way, because the time spans between poverty and hunger and what, you know, the effect that's having on people's lives right now, and changes that come down through policy is too slow. So there's a need for innovation, and I think certainly a great need for research translation to show what a community-led, what it looks like as a community-led venture to improve food security in Central Australia. Sorry, my words didn't come out very well. My apologies.
Thanks, Judith.
Thank you, Judith.
I'm just making notes madly here.
Disordered eating and poverty, and that link in remote regions, and the impact of disordered eating on health, because it's not clinically, there isn't a clinical diagnostic guideline yet for hospital staff and others to diagnose disordered eating as a contributor to outcomes. And informally, there may be quite a strong correlation between mental health, including suicide.
Wow.
But it's anecdotal at this stage. There's no, but it's, yeah, that's where we're sitting.
Yeah, very interesting.
Yeah.
Oh, yeah. I'll have a follow up on that discussion another time with you, Judith. I'd be very interested in.
Thanks.
Is that the work that Catherine's also involved in?
It is indeed. Yeah.
Give her a shout out to me. Say hello to her.
Yeah.
All right. Let's move to somebody else now. Come on. How about
I'm
happy. Miller? Who's that? Colleen, let's go with you. Colleen, thank you for stepping
Hello,
up.
everyone. I'm Colleen Gibbs. I'm for the past 5 years, I've been the Executive Officer for the National Indigenous Health Leadership Alliance, or formerly known as the National Health Leadership Forum. And I've taken that's now a reduced role, and I've also taken on a role with Indigenous Allied Health Australia as a policy advisor. So my answer would be comments would be in regard to the first question you raised about what do you want to hear from communities, and it comes to mind just with this recent work I've been doing, that although it's been involved in this space for a while, especially around workforce, the way that the Commonwealth Government frames the way it does, it supports the health system, is really about its responsibilities for the funding to the states and territories, but then its responsibility for primary health care is largely around the general practice model or the funding of the ACCHO sector. All their reviews and their subsequent reforms that they do is limited around that model. There is a very narrow view around the contribution around allied health towards healthcare outcomes. So it would be, and they've stated that there's no evidence to prove the efficacy of it. I think it'd be good to build some stories, real people stories, community stories around who they access and who they rely on for primary health care within their communities. Who do they trust to get advice on? And start building stories around that, because I don't think we're going to change or open up the way primary health care is delivered without getting those stories, because it just seems to be very hard to break down the way things are done because of funding restrictions. But there's not even a willingness to open up their mindsets and trial new things. And if they do trial it, they always, as somebody previously mentioned, They're very short term. There's no long-term sustainability, and I think that needs to be explored further.
You mean how they do things if they had all the money?
Well, and just a way just to allow existing workforces that may be out there to tap into some of that funding, which is largely restricted. So it's just different ideas that need to be explored.
Yeah. Okay.
Can I hop in there to add to Colleen's comments there? Thanks, Colleen. It's a really well, some of the things that you were saying there really resonated for me from the perspective of the Australian Physiotherapy Association. And look, certainly, as you say, we have a very, very GP-centric primary care model. Thankfully, within the ACCHO model of care, it's far more person-centred, but certainly in general practice, it is just that. It is general practice-centric. So whether, you know, I think we have a multi-pronged approach that we need to take to really facilitate and enable genuine reform in this space with the federal government. And as you say, having an evidence base is one thing, having multiple independent, exceptionally well-resourced reviews is another angle, but having the stories about what it actually really looks like, you know, winning hearts and minds, bringing people along for that ride. You know, we know that people have, you know, significant trust in their allied health clinicians that they work with. These are the stories that we need to tap into, and they are across an enormous breadth of fields. We're talking about aged care, paediatrics, chronic pain, respiratory, as a respiratory physiotherapist, I've forgotten my words, but anyway, you know, these are sort of where we have a plethora of opportunities where I think where I think collectively telling those stories about really how people's lives can be affected by proper multidisciplinary care and proper primary care that's not just focused on a medical model, I think would be a really amazing opportunity. And that's one of the reasons why we put up our hands to be founding foundational members, really.
Thank you for that, Catherine, and thank you, Colleen, too. I do want to draw people's attention to the chat, that there's a number of things people are writing in there, and also where are writing articles about. So just to draw your attention, if I go back onto the chat where I can read it, Mari said, I'm writing an article about primary healthcare, the way primary healthcare services are engaging with caring for country and environmental health interventions, and she'd be grateful for any tips and insights from people. So it's Mari McKinney. Kelly is on here, so we might hear from Kelly because I can't see her. The camera's off. It's playing up. So we'll hear from her because I wouldn't have seen her face to call her. Jason is also online today and said he's writing an article based on this discussion and keen to hear from people who fall through the cracks. And I know that Anne's responded there, but people can also follow up both Murray and Jason later as well if you can't put something into the chat now. So please do that, or if you were happy for Jason and Murray to contact you at some point later to follow up on the stories, they can do that too. All right, I'm going to ask Kelly, can you talk, and then we'll go to you, Marjorie, if that's all right. If Kelly's there. Might be gone. All right, we'll go to you, Marjorie.
Hi, Bronwyn. I'm going to go through the questions. First of all, I'm Marjorie Cross. I'm a general practitioner in Bungendore, New South Wales, southeast New South Wales. Our PHN is coordinator. I'll come back to that briefly. You want to know what stories I would like to see told from local communities in primary healthcare. Well, our local community, through my local general practice, developed Parkrun in the community. Okay. That's something that's been incredibly successful. So that's an untold story I'd like you to hear. In conjunction with CWA, Country Women's Association, we've developed some community information sessions. The next one's being a series of information on digital scams that people can and are affected by, the shame and derision people find, particularly women find if they've been conned into a digital scam or a dating scam is profound. And so as a result of community interaction and with the help of CWA, the imprimatur of CWA, we're telling those stories and we're trying to inform our community. These are some of the untold stories that I don't think people ever hear. So when it comes to primary health care and our coordinator, it has been, I know some of the primary health networks have been very successful. The one that's on here today is very successful. Not all primary healthcare networks have been successful. And even when they actually say we are successful, they seem to be self-audited. They don't go out into the community and find out what the community thinks. So the biggest barriers to wider implementation of comprehensive primary healthcare exist in the aged care section. That is very, very difficult for those people that need it and their families to access. And it may be a story that's being told somewhere, but in my community, we employed a medical social worker in order to try and help. And even he has great difficulty accessing and achieving available community placements and packages for the aged. And to me, this is an extraordinary, significant problem with complex and chronic care. So, by the way, my country is Ngunnawal, as I've got on the screen, but I'm coming in from London today because I thought this was so important to actually have some stories that no one ever acknowledges. And with response to the physiotherapist, I would just say that the patients would be, in my community, would all tell stories about how wonderful their chiropractor is, and their chiropractor does things that are really outside the scope of what's justifiable. But I won't go down that track any further.
Thank you for that, Marjorie. That was quite a comprehensive sum up. So thank you for that. And thank you for making the time to zoom in from London and work out the time difference and all that. I presume London in the UK, not London, Ontario.
I'm talking about London, the United Kingdom, and I'm currently in Golders Green.
Excellent. Thank you for that. All right. Let's hear from someone else. Kelly's back. Kelly, you're there. Let's hear from you.
Sorry, guys. I just had a bad connection there, so I just got out and got back in. Thanks for calling on me. I'm here at the Inside Out Institute for Eating Disorders, and just interested in hearing more about in the media and getting more messaging out about how people can treat eating disorders in primary care settings. We do quite a lot of that here, and we have a lot of stories to share, and interesting to hear from the earlier person about disordered eating and access to food in remote communities. That's something that we're interested in here as well. So thank you.
Thank you for that, Kelly. Thank you for that. It's a bit of an overlap there in interest, so it's important to note that. Nell?
Thanks,
Put your hand up, Nell.
Yes, I'm from the Local and Independent News Association, as Melissa mentioned earlier, and so clearly outside the health area, and this won't be the most constructive comment, probably because it's something that Croakey is already doing so well, in my opinion, but I just want to acknowledge their work in seeking out those underrepresented stories and voices that may be getting overlooked in a lot of narratives, particularly mainstream media narratives and such, and the intersectionality of the reporting as well, covering such a broad range of topics within that health broad umbrella. So yeah, well done to Croakey, and we're very proud to be supporting your work however we can, and congratulations on the 10 very impactful years. And I'm also looking forward to reading the stories that come out of this as well, this meeting.
Thank you. Yeah, I am too. Heaps of stories. Let's bring it on, the next 2,000 stories. All right. Of all of these different issues. I'm going to ask you, Tammy. Haven't heard from you yet.
Hi, I'm Tammy Wolfs. I'm also on Ngunnawal country. I work for Capital Health Network, which is Canberra's PH. I guess the views I express are probably not necessarily, probably more my own. I agree with what Margaret was talking about in terms of, and some of the others in terms of particularly grants and pilot programs that's kind of never get anywhere. I think the classic examples are with social prescriptions and navigation, which are kind of built in now into many of the government's long-term health strategies and health plans, the preventive healthcare plan, primary healthcare plan, and quite a number of others, as being something that will be rolled out nationally within the 10 years of the plans and strategies. Most of those is kind of halfway through, but nothing seems to progress beyond piloting and funding, funding through grants or new pilot programs, but without bringing that in as national programs. That does seem to be something around the way it's a budget issue, I guess. One of the, I do also want to raise in terms of the stories. A couple of weeks ago, I went to was part of a health homelessness forum, and there are a lot of really innovative, great programs. Again, they're all, this is the issue though, they're all small programs, they all work really well, they're really inspiring, worth having a look at the program and some of the areas around the country that have initiated and innovated and are really making a huge difference to their local communities. But again, things that would be fabulous if they were national, but are confined to those sort of really local programs. So great innovative stuff, but local, everything's local.
Yeah. Thank you for that. And I note too about the, nothing moves from pilots and the projects are not sustainable. And I'm aware, there's some pilots in a range of areas that are 40 years on. So you kind of go, when is it going to cease to be a pilot, and when are they going to fund things appropriately as well? So you get that one at one end where you've got little projects that just have a pilot and they don't fund anything else, and there's no real evaluation through to the ones that people know are working, but they don't do a formal evaluation, but they keep funding them as pilot after pilot, so that we end up then with 40 years on of pilots. Yeah.
Exactly.
Yeah. All right. Thank you for that, Tammy. I'm going to ask, I think it was Fiona. I saw a Fiona here come up across my gallery at the bottom. And also, yeah, Fiona.
Oh, hi. I'm just enjoying listening to the conversation. Nothing to add at this stage. I think there's a lot of merit in talking more about multidisciplinary team care. I think that's a really, really important topic. And so I'm from WA Primary Health Alliance, so WA's 3 PHNs. And I know that we've certainly run some pilots, which we, around social workers in general practice that have been very well received, and also non-dispensing pharmacists. But it's the same old challenge around funding comes, funding goes. Nurse practitioners is another one. So it would be really nice to start to build, I think, a bit of a groundswell of evidence for those things, which really play a vital part in the future of the primary care system.
Thank you, Fiona. I'm going to go to you, Margaret. You've got your hand up, and then I'm going to come across to R. Batley. I can't see your first name. So, Margaret, you first.
Yeah, thanks for a second bite at the cherry. I think another topic that is certainly of interest to rural practitioners, and it'd be great even to hear from the physios, it's about, single employer, I suppose, across primary care, aged care, disability, hospital sector. It's the barrier that we keep hearing time and time again about how you can have those health professionals working across sectors with those different funding buckets. There's obviously some movement on single employer models for GPs or early GPs.
Yeah.
But it's such an obstacle of getting that good primary care when the funding buckets stop people moving across the different sectors.
Thank you, Margaret. I'm going to ask R. Batley, you got something quick, because then I'm going to move to the summary. Thank you.
Oh, sorry, that's me, Rachel. I might throw it to my boss, Catherine, though, if it's read the physio question.
Oh, is Catherine? I think she spoke earlier.
Yeah.
That's all right.
Sorry, I'm a new policy advisor, but I've come over from media, so I'm keen to get writing stories.
I'm just conscious we haven't heard from others. I'm conscious as well it's 10 to 5, and we do want to see what we were scheduled to finish here at 5, but we've heard quite a number of speakers. I do want people to follow up with Melissa or with Croakey later after today's session in regards to any, other issues or points that you want to raise about stories. But so far we've heard around energy limiting conditions and a range of conditions, and care needs there's a lack of care being provided. There's also a lack of understanding around those illnesses and the total limiting capacity for some people, and the lack of education for GPs around the issues with people with energy limited conditions, but told from the patient's stories, right? Not from necessarily, any practitioner story, but patient stories, acknowledging that some patients can also have been practitioners. We've heard about learning projects and innovative projects, but also no way to share. The National Oral Health Plan is out now for consultation, so please get on and put some discussion into that around the consultation, or put up a submission. We need to activate now before that submission closes. Food security and the needs to address that and to dive into community around poverty and disordered eating, mental health overlapping, and stories about services and how they do what they've got, and with different ideas. We need independent, well-funded stories to get messages out and examples of good practice. We did hear those stories of like a park run, the CWA, and I'll give a shout out to CWA people. I'm a member of CWA, and the work that they're doing within the health space around the impact of digital scams. Not all primary healthcare networks are successful, and I took that message away too. The aged care packages, not enough in the program, and it's a significant issue. And Nell said about hearing from the overlooked voices and the intersectionality of people and voices, and pilot programs that don't go anywhere. Also, the multiple disciplinary care. Lots of other things came up. That's just some of the things I heard. This is recorded, so we'll get all of those. And Melissa's going to tell us what we're going to do with these next. So over to you, Melissa.
Thanks so much, Bronwyn, and everyone for your contributions. I've been frantically scribbling notes. I think thanks for the summary, Bronwyn. I think the underlying thing that I was listening to through all of those issues is the importance of storytelling. Stories really have impact. They move people. They can create change, whether it's change in policy or practice or community understanding, the stories that are told or not told. So that's, really our thinking behind this initiative is to provide a platform for storytelling. And to be perfectly honest, it's also a way for us to try and raise some revenue to support journalism. As we all know, local communities have lost a lot of news outlets. Nell could probably speak much more to that. I know Lena's involved in growing and supporting the development of more local newsrooms, but there's still such a dearth of really solid evidence-based local reporting. Local reporting isn't just important for keeping local communities informed, as you were making the point with pilot programs that don't go anywhere, etc. It's telling stories from local communities that can then create change or momentum for change in national policy, create that political pressure. So I think, that's where we're looking big picture for the stories that we'll do. But Jason and I'll have a chat after this and work out how we'll cover this for Croakey Bulletin this week. I think probably it's useful just to, give an overview of the range of issues that were discussed. I mean, we could follow up on any one of a number of stories down the track recently. Jason may reach out to some of you by email for a bit more information. I'd just really like to acknowledge Marjorie for dialing in from London. Exceptional commitment. I don't know what the time is with you, but thank you.
And it's, middle of the night or something like that.
Yeah. So we're hoping to launch the portal in early October. How it will work is do you remember with the voice referendum, we had that portal on the homepage and then you could click through to a standalone page which compiled all the articles. So that's really the model that we're working to, learning from what we did with that. And the articles will also be published, in the weekly Croakey News Bulletin as well. So it's really just providing that additional platform. So once we launch, we will be publishing both journalism and the funders, so acknowledging the Northwestern Melbourne PHN and the APA. We will, as part of their funding, they get some sponsored content articles. So we'll be publishing their articles. So, for those of you who might have organisations able to engage or fund going forward, that's the model we've developed so far in terms of sponsored content to raise the funding for the portal. But we are very flexible. So if other organisations, for example, might prefer to have a Croakey Live than sponsored content, we can discuss options. But it will really depend on the sector stepping up, after these initial funders to enable us to have the funds going forward to keep commissioning the journalism. But at Croakey, we're very good at doing a lot with little. So, I think just having the portal will give us the impetus and momentum to keep a more sustained focus on primary health care. A lot of what we do at Croakey is big picture sort of concept issues, op-ed articles and so on. And I think it's really that local storytelling that will add a lot of impact to the raising of those issues. We can talk about the social determinants, we can talk about the cultural determinants, we can talk about, impact of poverty and food insecurity and housing insecurity, but it's really when you tell the stories from people, from communities experiencing those events or situations that will have a lot more impact, I think. So we'll really look forward to hearing from you all, reach out, pitch us stories, ideas, critique us, tell us what we've missed in our coverage. We welcome all engagement. So that's any questions, anything I haven't covered there? Make sure you read the Zap every week. Charles has covered a lot of very
and just to remember the hashtag #PHC matters. #PHC matters. When I point, then you're going to go hash, right? And then PHC matters. Ready?
PHC
matters. That's right. Okay. Thank you. Thank you all for joining us this evening or late this afternoon. This evening, Marjorie's case, it's in the morning. But thank you all for your contributions today and for helping us celebrate the 10th year anniversary of Croakey. We haven't had a range of things happening this anniversary, but also then helping to get this portal commenced and the stories for that portal and ideas for portal. So thank you once again, everybody. Thanks for joining us. See you all another time. Bye-bye.